everybody, it's Tracy from Downward Dog Rising, and tonight I invite you to do this video if you have lower back pain or if you have a newly injured low back area of lumbar spine with herniated disc or a bulging disc, maybe an L4, L5, S1, any of those areas. Tonight's video is going to be dedicated to just trying to get the pain to release a little bit as you stabilize your lumbar spine and as you do deep breathing and recruit all of your abdominal muscles to try to support your spine. So this video isn't really a fitness video, it's more to get stability so you feel like you can move without pain shooting into your leg, into your low back. So if this sounds like something you need right now, then join me. All right, let's begin. Let's start off. You could do this lying on your bed. You could do this lying, if it's too hard, it hurts to get up and down off the floor and you don't feel stable, by all means, you don't want to get up and down off the floor. You could use a weight bench if you have one. You could use your bed. You want it to be a little more firm, like a soft sofa won't work, but a bed would work. Okay, let's start. I want you to lie down. We're going to call this constructive rest position so that your shoulders, your hips, the center of your kneecaps are aligned over second toes. So we line up all of our joints, shoulders, hips, knees, ankles. We're going to do some visual imagery. Lie on your mat or on your bed. Just take a second to focus inward. Breathing in and breathing out. Notice how the breath enters. Breathe in through your nose. Breathe into back and sides of rib cage so your ribs laterally expand. The back of your ribs inflate so they push into the mat underneath you. Arms reach long by sides. Inhale, head lengthens away from tailbone. Exhale, just relax your ribs so they all funnel. Ribs rise. Ribs fall. Ribs rise. Ribs fall. One more time. Ribs rise. Ribs fall. Place your hands on your two hip bones, anterior superior iliac spine, ASIS joints, those two bony protrusions right there. Now imagine, pull them together. Horizontal line, fibers pulling straight across and together like a belt wrapping you, giving you support. That's one line of support. Horizontally, belt wraps. It comes around the sides tiny little bit here. As that belt tightens across hip bone to hip bone, lengthen head away from tailbone. Deep inhale. Head lengthens away from tailbone. Exhale and inhale. Now really tighten your abdominal wall from pubic bone to navel. Pull in like a zipper. Zip up your jeans. Lift up. Breathe in. Zip up. Narrow hip points. Exhale. Spine is long. Your back is really against the mat. Breathe in. Exhale. Your back is on the mat. Ribs fall down together. Funnel down. Alternating knee bends. Breathe in. Exhale. Breathing in. Abdominals draw in and lengthen and zip up to navel. Inhale through nose. Exhale through mouth. 4 more. 3. 2 more. Spine is long. Last set. Okay, good job. Next, one hand to one side of rib cage, the other hand to the other side of your rib cage. Still breathe in through your nose. Lateral rib cage expansion. And then exhale, funnel them down, pull fingertips together with each exhale. Release through breastbone. Sternum melts down. Mid-back, thoracic spine connects into mat. Expansion outward. Draw in close together. Dropping down. Ribs connect. As ribs connect, probably 10th rib draws in together. Middle of back elongates. Thoracic spine in between blades, shoulder blades and back, releases into mat. Exhale. Release through breastbone, sternum. Couple more. Keep drawing in from pubic bone to navel. Zip up. Use those deep core muscles. Pelvic floor lifts. It's as if you're reaching three-dimensionally from the front of the body to the back of the body. You have the front of the spine from the anterior front. You have the back of the spine from posterior back. Scoop in, zip up, expand sideways. One more time, breathe in. And then exhale. Okay, we're gonna put all three together. Head lengthens away from tailbone. Spine elongates. One. And then the next one, hip points come together. Feel the horizontal recruitment like a belt wraps you. And then we have vertical, we have horizontal. Our obliques, think of a V, think of an upside down V and a right side up V. Internal, external obliques run on a diagonal line. And then place your thumbs at the bottom of your ribs, each side of your rib cage. Place your index fingers on your hip bones, that ASIS, anterior superior iliac spine, the bony protrusion of your hip. Try to make their soft tissue between the last rib, floating rib, and the hip bone on each side. There's soft tissue in between that space. Now imagine we wrap a belt, like a black belt that people wear when they're moving things. Even people at Home Depot that work there, they're lifting things, they're going up and down off a ladder. You see these belts going around their waist. Think of something cinching, wrapping your waist. Your spine lengthens. Now as you do that, press your palms firmly into the mat. And then I want you to just do a small pelvic tilt. Stop if it hurts your back. The spine lengthens into the mat. 12 o'clock is navel. 6 o'clock is pubic bone. 6 o'clock is actually going to load your lumbar spine and shorten it. So watch when you tilt forward. You might not go very far. You don't want to compress your back. Pull in, lengthen up the wall. Abdominal wall pulls into the anterior front of the spine, lengthen back into mat. Once you feel an imprint, we're going to use imprint right now to help you. Scoop into your center, create length between ribs and hips, and you're going to rise up, and then you're going to lower down. If there's no pain here, you can neutral, go into neutral spine, where a straight line is between hip bone to pubic bone. So hip bone to pubic bone. Here's a posterior tilt. You can see my hip bone is lower than my pubic bone. Anterior tilt, you can see my pubic bone is down lower than the hip bone. So in one way, pubic bone's higher, and one way, pubic bone's lower. In between those two tilts is neutral. The hip bone and the pubic bone is in the same alignment. Open collarbones, abdominals draw in, and just lift straight up. Weight is across shoulder girdle. We're not going to turn the head, just look straight to ceiling, keep neck long, but I assure you there's no weight in my neck, it's across my shoulder girdle. Really keep the gap between the rib cage and the hips open. Set the pelvis straight to the mat, keeping that neutral hip bridge. Hinge at the hips up, engage glutes, scoop in, lower down with control. Go really slow, 8. Pull your abdominals through so this part of the back will not arch, it's going to be elongated. Come straight back to mat. 7. Push down into all 4 corners of your feet. Tailbone stretches away from breastbone. 6. If this hurts your back, stop and do not continue. Just stay with your back lengthened into the mat and just do deep inhales and exhales as you scoop abdominal wall into the anterior of the spine. 5. Press hips to sky. Lengthen your tailbone away from breastbone. 4. Lengthen tailbone away from breastbone, hips to sky. 3. Remember, if any of this hurts your back, stay on the mat. Avoid lifting. 2. Last one. So if your back hurts to lift, here, we're going to backtrack. Narrow the 2 hip points across. Your feet are flat on your mat. Feet are flat on the mat. Hip points come together. Head lengthens away from tailbone. Fan your knee to the side as you keep pulling those 2 hip points together. Breathe in. Exhale, pull the 2 sides of the ribs together as those hip points pull together. There should be no motion in your hips. Avoid doing that. Avoid twisting your spine. Avoid rotating your hips off mat. Back of pelvis firm on mat. Knees sway to the other side. You're actively scooping your abdominals in from pubic bone to navel. You're actively drawing hip points straight across. Exhale. Inhale without moving either hip. Okay, we're going to do one side at a time. Do left leg. Exhale. Spine is long in mat. Breathe in. Space between ribs and hips. Soft tissue is wide open. Avoid hip hiking. 7. 6. Your back is in mat. 5. 4 more. Keep spine long. Avoid moving hips. 3. 2 more. Tighten core to spine. Last one. Okay, other side. Keep hips open. Ribs out of hips. Breathe in. Exhale. Draw your hip points closer together. Breathe in. Exhale. Knee sways to the side. Fan it out. Hip points come across. Space between ribs, hips. Spine is long. 8. Ribs connect. Wrap. 7. Use those obliques. Wring out the wet sponge and soft tissue. Wring out the wet towel. 6. Wrap. Abdominal wrapping. 5. 10th rib pulls down together. 4. Breastbone softens. Rib cage connection in front. 3. 2 more. Last one. Good job. Hug under the knee joint. Extend other leg straight and let back release into mat. Stay here for a second and breathe. Breathing in to low back. Exhale, release. One more time, breathe into low back. Exhale, release. Extend leg long. Hug knee to chest. Reach underneath so you don't put pressure on kneecap. Breathing in. Spine is long. Head away from tail. Exhale, release. Breathing in. Back is long. Exhale, release. One more time. Breathing in. Exhale, release. Slowly bring foot to mat. Bring the other foot to mat. Okay, next exercise. Spine elongates, head away from tailbone, arms to sky. Gently press back of head into mat, lengthen back of neck. Float only your shoulder blades. The shoulder blades, the scapula, are flat, wide bones across middle back. So your rotator cuff muscles are attached. They're under, and what I want you to do here is float up. We're going to get into your subscapularis. Float up, pull the blades into the mat. Blades move away from the middle of your spine. Blades pull back into the mat. As the blades pull down into the mat, each collarbone widens across front of shoulders and chest. We're going to work with force couple at the shoulder joint. We have a force coupling. There's a lot of different bones and joints and muscles intersecting here. So we don't want the front to get super tight from sitting all day at a computer, and we don't want the back to get weak and overstretched. Blades lift up, blades reconnect. Blades lift, blades reconnect. 3 more. Spine is long. 2 more. Well, let's do external rotation in case shoulders are internally rotated and hiking towards ears. Float blades up. Turn thumbs out. We're working with your natural bone rhythms. We're going to twist your humerus, your arm bone, deeper into your shoulder socket, deeper into the glenoid fossa. Blades lift off mat, away from center of spine, reconnect into mat, up and out, rotate. So if you're wondering, how is she turning her fingers, her hands? Thumbs face each other, palms away, float up, rotate thumbs to side walls. Rotate thumbs so they face each other, pull blades down, up, out, in, down, up, out, in, down. 3 more, up and out, in and down. 2 more, up, out, in, down. Just working with those bone rhythms. Last one. Now, take your hands, cradle your head with your 2 hands. And I don't want you to flex your spine. I don't want you to do a crunch. And if you have osteoporosis, we definitely don't want you to do spinal flexion. You would avoid this at all costs, pulling your elbows together, pulling your chin down. That's not what I'm looking for. I'm looking for your tailbone to be on mat, stretch, elongate the entire spine to the top of your head. Your elbows open far and wide. Your collarbone spread across front of chest. Breathe in. Now your abdominals streamline into the front of the spine 3-dimensionally through your body, elbows wide. Now the spinal wall, the abdominals, think of doming the abdominals anteriorly to the front of the spine. They scoop in, they drop down to the posterior of the body, but we're reaching into the front of the spine. I want you to strengthen your neck, press all 4 corners of your feet into the floor, into the mat. Pull your abdominal wall as if your whole abdominal wall falls into the low back area. Come down. Breathe in. Exhale through mouth. Pull into your abdominal wall. Pull in into the spine. Press all 4 corners of your feet to the mat. Lower down. You're not flexing your spine. You're just doing, we're going to call this head float. To make sure you don't flex your head and neck, take your thumbs under the sides of your jaw, right under the bone of the jaw along the side here. Place your thumbs there. Create a little length as if you're lifting your head off the top of the spine. Float up. Use your abdominals to do it. You might shake a little bit in there. Float up. Keep lengthening head away from tail. Come back down. So I'm pulling my head longer before I start. I don't want you to flex. You're lengthening. Float up. Scoop in. Hold. And down. You should really feel tone in your abdominals pulling into your low back. Press all 4 corners of your feet into the mat. Good. 6, Really scoop in. Elbows wide, chest open. 5. Exhale, scoop in. Your abdominals are working really hard to support your back. 4. 3 more. 2 more. Exhale. Last one, keep length. Lower down. Bring your arms by your sides. Okay, next. Chin nod. Avoid lifting head off mat. Tilt up, tilt down. I want you to release at the base of the skull, the occiput, first cervical vertebra. So it's a small motion. Up, down, up, down. Create length. Up, down. 2 more. Last one. Now, eye gaze is straight to ceiling above you. Go to the very tip of your nose. Relax your shoulders. Make a circle on the ceiling with the tip of your nose without lifting your head up. Second cervical vertebra. We have the atlas and the axis. Reverse. Opposite direction. Soften down sides of neck, soften your mouth, facial muscles and jaw. Come back center. Now, shrug shoulders towards ears. Inhale. Release any tension through fingertips. Exhale. Keep a little bit of abdominal tone in there, pulling inward. Shrug up. Exhale, reach fingertips long. Release tension through fingertips. Shrug up. Release. Shrug up. Press all 4 corners of your feet into the mat. Shoulders shrug to ears. Release tension through fingertips. 3 more. 2 more. Last one. Press your palms firmly into mat. Keep shoulders away from ears. Lengthen both sides of your neck. Both hip points draw together. Belt comes around you. Spine elongates into mat. Scoop in from pubic bone to navel. Wrap your ribs. Inhale, ribs expand laterally. Exhale, wrap around to center. Arms reach long. Spine is really lengthening. Inhale to prepare. Exhale. As you exhale, your abdominals deepen. See if you can lift your feet. Not high. Inhale. Tone into here. See how high? That's it. You're not lifting here. You're not going up high. Brace across. That's it. Breathe in now. Exhale. Pull your ribs together. That's it. If this hurts, stop. Exhale. Really scoop in. 4. 3. Exhale. 2 more. If this hurts, stop. Really tighten in. All right. One more thing. The space between your ribs and your hips. Hip bones are 3 o'clock, 9 o'clock, face o'clock. Navel 12, pubic bone 6. We have the 4 numbers on a face of a clock. What I want you to do, keep the back of your pelvis, sits bones grounded into mat, space between ribs and hips. Slant your knees ever so slightly to right side of body without rotating hips off mat. Create elongation between your hip bone and your rib cage. Take a moment, collarbones wide, cactus your arms, meaning field post arms on mat. Stay here. Now just try to breathe into the side of your rib cage. Breathing in. Fully expand into sides of ribs. Feel your ribs stretch apart. Exhale. Breathing in. Fully expand, ribs apart, ribs out of hips. Exhale. 3 more. Collarbones wide. 2 more. Create elongation on left side of spine. 1 more. Return center. Ribs out of hips. Ever so slightly without rotating. 3 to 9 off mat. Sway your knees to the other side. Ooh, that side's tighter. If you notice one side tighter, like I just did, careful not to rotate or lift off mat. Your body's telling you something. Send your inhale, ribs out of hips, cactus your arms, chest open, collarbones wide. Take your inhalation. We're going to practice something with your chi, your prana. Breathe in to the tight spot. Inhale, inflate it. Really breathe into it, expand it. Narrow the hip points together. Exhale, try to get space in that compressed spot if you have compression anywhere. This just reminded me of how compression feels. We want to open the compression apart and restore blood flow to the area. Give oxygen, breathing in. Lateral ribs expand, spine is long, space between ribs, hips. Exhale, scoop abdominal wall to spine. Make as much room as you can in the soft tissue between the bottom of the rib cage and your hip bone without rotating pelvis off mat. I'll explain what I'm feeling. My quadratus lumborum right now is pulling tighter on one side of my back, and I can really feel it. And I can feel tightness in my ribs. I'm trying to expand and open it up using the breath. That's either or. If you felt it like that on the other side, sway knees to the other side right now and inhale into sides of ribs, expansion. Our bodies aren't uniform and symmetrical on each side. Ideally, that's what we wish, we hope for, we strive for. But we're not robots, and we don't use our bodies exactly the same on each side. We're usually left-handed or right-handed, and you're going to be more dominant on one side unless you use both equally, ambidextrous. But it's really hard to do everything equal on each side. Breathing in, exhale. Space between rib and hip, come back center. Okay, we're going to end with half happy baby, Ardha Ananda Balasana. If any pain happens when you lift up your leg, when you grab your foot, stop and just do constructive rest pose. Arms by sides, knees are bent. This is constructive rest pose, so your pelvis sinks into the mat, your hips are relaxed. Stay here and breathe. That's all you have to do. Stay here, breathe, sink into the mat. If you want to try something to go deeper into your hip, narrow your hip points, spine is long. Bend knee in. Again, if there's pain anywhere, stop right here. If you're pain-free, grab pinky toe side, lateral edge of foot. Let your knees start to fall to your armpit. And just stay here. Shin aligned, knee, ankle. And just stay here and breathe. Allow the back of the pelvis to fall into your mat. Scooping into your center. Let your back lengthen and drop into mat. Breathe in through your nose, exhale through your mouth. Spine is long. Okay, if you've had a hip replacement, reach under your knee. I just remembered, if you had a hip replacement, here's 90. Hip, knee. You would just rest your elbow on the floor by your side. Let your leg hang. Elbows on ground. Knee and hip. Avoid having your knee go higher than your hip if you've had a hip replacement. And just let the femur bone sink deeper into the acetabulum, into that ball and socket joint. It'll feel safe down into there. So if you did have a hip replacement, that's what you would do. Reach under the knee. Release that side If there's pain, constructive rest position, relax those hip flexors, knees bent, feet flat. Bend other leg in. So if you had a hip replacement, your knee can rest on the mat. Your elbow can rest. Knee and ankle align your shin, and you would just straight line, knee to hip. Let your femur bone fall into the back of the pelvis. Just let it drop in to that ball and socket, into that acetabulum. The back of the pelvis is going to feel like it widens into the mat. Stay here and breathe. Okay, if you haven't had a hip replacement, reach to lateral, pinky toe side. Allow your knee to drop outwards towards your armpit. And just feel the crease in the front of the hip. Stay here and breathe. Knee back is lengthened into mat. Back of pelvis widens into mat. Hip points draw together in front. Breathing in, breathing out. We're almost done. One more deep inhale here. Gently bring foot to mat. Slow little sway side to side. Stretch legs long. Reach fingers away from toes. If this hurts your back, if this is too much, stop. 3 deep inhales. Elongate. Scoop abdominals into back. Fingers away from toes. My back is lifted right now. If this is too much, stop. Fold knees in. We're going to end. Turn to your side. Stay here for a second. Breathing in, breathing out. We're not going to just jump up in case your blood pressure changes fast. If we lie on our back, that's one thing. If you're seated, when you change directions, have you ever noticed if you're lying on your back and you just jump up, you see stars like you're going to pass out? There's something called orthostatic hypotension with your blood pressure changing really quick. So before you change positions, take a couple seconds, breathe, and then just get ready. Slowly push up. Use your arm. Push up to seated position. If it's too much to sit like this, you would just, if you're on your bed, you could just push, use your arm, come all the way up, walk, slide to the edge of your bed, bring your feet to the edge so you could just squeeze your glutes, stand, come up. If you're on the floor and you have a mat and you need to get up, you're okay to lay on a mat and on the floor, but you're not so sure how to get up. Tighten in, use your core. Curl your toes under, pull your core to support lumbar spine. Take one foot up. If you have anything, a chair, a table, a bench, yoga block, anything you can use, avoid pushing on knee, push on thigh, put weight into back foot, and stand like that. All right. So that concludes our practice for tonight. And like I said, this practice is for anyone who has a freshly herniated disc, bulging disc, you're coming back from hurting your spine. You really need stability, and you need to really deepen your core connection to offer spinal support. So today was a slow moving workout, and once I bulged a disc and it almost herniated, but it went back in because I did the right things. and I just naturally go from one thing to the next, to the next, to the next, what feels good on the body. So that's how I can explain what to do, because when you herniate something, you can't move, you can't breathe, you feel like you're going to break into pieces. If you take one breath or you move a certain way, it feels like it's all going to shatter. So you have to be careful how you move. All right, thanks for joining. Peace. Take care. See you soon.